Welcome. Have you ever experienced an annoying itch deep inside your ear, perhaps after a swim? It could be otitis externa, commonly known as swimmer's ear. In this video, we'll dive deep into this common condition, exploring its causes, symptoms, treatments, and preventative measures to help you keep your ears healthy and happy. So, what causes swimmer's ear? The primary culprit is excess moisture trapped in the ear canal. This creates a humid environment perfect for bacteria and less commonly fungi to thrive. Swimming, especially in contaminated water, is a major risk factor, hence the name swimmer's ear. However, anything that introduces moisture into the ear canal, such as showering, sweating, or using cotton swabs improperly, can also lead to otitis externa. Other contributing factors include skin conditions like eczema or psoriasis, and even earwax buildup. Let's explore the pathophysiology. The ear canal is normally protected by a thin layer of earwax, which has antibacterial properties and keeps the skin healthy. When excess moisture enters the ear canal, it can wash away this protective wax. This disrupts the natural barrier, making the skin more vulnerable to infection. Bacteria or fungi then invade the skin lining the ear canal, causing inflammation, swelling, and pain. The inflammation further traps moisture, creating a vicious cycle that worsens the infection. Otitis externa is a very common condition, affecting millions of people each year. While it can occur at any age, it's most prevalent in children and teenagers who are more likely to swim frequently. Swimmer's ear is more common during the summer months when swimming activities are at their peak. Individuals with pre-existing skin conditions, narrow ear canals, or those who use hearing aids are also at an increased risk. How do you know if you have swimmer's ear? The symptoms can range from mild to severe. Early signs include itching inside the ear canal, mild redness, and slight discomfort. As the infection progresses, you may experience intense pain, especially when moving the ear or jaw. Other symptoms include drainage of fluid which may be clear, white, yellow, or even pus-like, a feeling of fullness in the ear, decreased hearing, and even swollen lymph nodes around the ear or neck. In severe cases, the infection can spread to the surrounding tissues, leading to cellulitis. Diagnosing otitis externa is usually straightforward. A doctor will examine the ear canal using an otoscope, a specialized instrument with a light and magnifying lens. They'll look for redness, swelling, and drainage. Gently touching or moving the outer ear often elicits pain in affected individuals. In some cases, a sample of the discharge may be taken and sent to a lab for culture to identify the specific bacteria or fungus causing the infection. This is particularly useful for recurrent or severe infections. Otitis externa can be broadly classified based on the causative agent. The most common type is bacterial otitis externa, caused by bacteria like Pseudomonas aeruginosa or Staphylococcus aureus. Fungal otitis externa, also known as otomycosis, is less common and is typically caused by fungi such as Aspergillus or Candida. In some cases, otitis externa can be caused by an allergic reaction to ear drops, shampoos, or other substances that come into contact with the ear canal. The primary goal of treatment is to eliminate the infection and relieve the symptoms. The cornerstone of treatment involves ear drops containing antibiotics, antifungals, or corticosteroids. Antibiotic ear drops are used to treat bacterial infections, while antifungal ear drops are prescribed for fungal infections. Corticosteroids help to reduce inflammation and swelling. Before administering ear drops, the ear canal may need to be cleaned by a healthcare professional to remove any debris or excess wax that could interfere with the medication's effectiveness. Pain relievers, such as ibuprofen or acetaminophen, can help manage the pain. In severe cases, oral antibiotics or antifungals may be necessary. Prevention is key to avoiding swimmer's ear. The most important step is to keep your ears dry. After swimming or showering, thoroughly dry your ears with a clean towel. You can also use over-the-counter ear drying drops containing alcohol or acetic acid to help remove excess water. Avoid using cotton swabs to clean your ears, as they can push wax further into the ear canal and irritate the skin. Consider wearing earplugs when swimming, especially in lakes, ponds, or other bodies of water that may be contaminated. If you are prone to earwax buildup, consult your doctor about safe and effective methods for earwax removal. With prompt and appropriate treatment, the prognosis for otitis externa is excellent. Most infections clear up within a week to 10 days. However, if left untreated, otitis externa can lead to more serious complications, such as chronic infections, hearing loss, or spread of infection to the surrounding tissues. Recent research is focusing on developing new and more effective topical medications for treating otitis externa, as well as exploring alternative therapies such as probiotics to help restore the natural balance of bacteria in the ear canal. Researchers are also investigating the role of biofilm formation in chronic otitis externa and developing strategies to disrupt these biofilms to improve treatment outcomes. Remember, Consult your doctor for proper diagnosis and treatment to keep your ears healthy.